Hello, my name is Dr. Neeraj Narula, and I'm a gastroenterologist at McMaster University and the director of the Inflammatory Bowel Disease Clinic at Hamilton Health Sciences. You may have heard that some patients are being switched from their biologics, Remicade or Humira, to biosimilar drugs. Infliximab biosimilars include Inflectra or Renflexis or Efsola. Adalimumab biosimilars include Abrelata, Julio, Hyrimoz, Hadlima, Amjevita, and Adagio. My experience thus far with biosimilars has been good. For example, I have many patients who've used Inflectra and Renflexis, and my experience has been that they are similar. So similar, in fact, that I have no medical or non-medical recommendation to make to you about which one to choose. Both have structured their ecosystem that surround these medications extremely similarly. This includes their very inclusive and well-designed patient support programs to help you navigate the insurance processes and help organize your infusions. I think one of the most relevant factors in this process is the location of the infusion clinic. For those patients who have to travel significant distances to infusion clinics, I would choose a brand of infliximab based on your travel time. You might be wondering, why are you being told to switch to a biosimilar? Since they are complex, biologic drugs can be very expensive to produce. Once the original patent of biologics expires, other companies can make these medications. A healthy and competitive drug market can support more manufacturers to produce new and affordable drugs. Cost savings can also be realized by our provinces. In other provinces where switches have already happened, savings have been reinvested into our healthcare system with announcements of coverage for new medications. Although a biosimilar is not identical to an originator drug, there are no meaningful differences between them. The same safety, efficacy, and health outcomes is evidenced by a large body of clinical studies. Health Canada expects no clinical differences between a biosimilar and its originator biologic and assures patients and health professionals that biosimilars are safe and effective for their approved indications. Many European nations have required patients taking originator biologics under publicly funded coverage plans to switch to biosimilars. These patients have been tracked in many studies. The clinical trials and registry data findings are regularly reported at international annual scientific meetings. There are now extensive research studies in rheumatology, gastroenterology, dermatology, and other diseases which collectively suggest that no meaningful clinical differences for the majority of patients after a switch from an originator biologic to a biosimilar exist. The Ministry of Health will be carefully monitoring drug usage, patient outcomes, and feedback from patients and healthcare practitioners both during and after the biosimilars initiative. I think based on the data, it is clear that from an effectiveness and safety perspective that any of the infliximab and adalimumab brands we have to choose from are extremely high quality. I feel confident that if you are forced to switch, you'll be okay. If you do have private insurance, you should speak to your insurer to find out whether you need to switch. I do, however, anticipate that switching will be a relatively common occurrence down the road. Thanks for listening, and I hope you found this short video helpful.